Howdy! Our project is about religious influences on the use of contraceptives. My name is Margie Fassett.
My name is Peyton Boren.
My name is Lolly Sanchez.
And my name is Chukli.
Cool, so we'll jump right into the introduction. How do you think religion and contraceptives relate? So first, we're going to look at religion. There are over 4,300 religions across the world, with nearly 75% of the world's population identifying as one of the 5 most influential religions of the world: Christianity, Islam, Buddhism, Judaism, and Hinduism. Most religions have the same view towards the idea of reproduction. However, the acceptance of contraceptives deviate through every religion. Contraceptives is a very common practice among sexually active individuals. It encompasses different methods used to avoid unplanned pregnancies and STIs. Some common contraceptives are oral contraceptives, male-female condoms, emergency contraceptives, spermicides, diaphragms, and IUDs. A former research study done by the University of Florida tested the popularity of different types of contraceptives on a college campus and determined which contraceptives were heavily used and which were not. Based on the data, we can see that some popular methods within the sample is abstinence, male condoms, and oral birth control. Some of the unpopular methods were diaphragms, female condoms, and NuvaRing. Cost can also be barriers between obtaining different types of birth control. So many religions have the same view towards contraceptives, such as it's against nature or it conflicts with God's plan. Many religions just view sex as a procreation practice. An example of negative views towards contraceptives from a religion is the Catholic Church. The Catholic Church banned all contraceptives and birth controls. However, they did allow for oral birth control for health reasons, such as stabilizing irregular menstrual cycles. Another example of religion versus contraceptives are people who worked under religious employers, such as certain religious schools and churches. Due to the Affordable Care Act of 2012, most health insurances had a healthcare plan which covered contraceptive services regardless of employer views. However, in 2018, Trump administration issued a rule that employers can opt out of covering contraceptive services in employee healthcare plans based on religious or moral objections. An estimated 126,000 women lost their coverage of contraceptive services, and this shows that religion can play a big factor when it comes to birth control.
Okay, so thank you, Nagis, for your introduction. And this is how we raise our surveys. So the surveys were designed to collect the student experience about how their personal sexual behavior relate to their relations and how relations affect the choice of contraceptive. So this is gonna be like 6 questions, or multiple choice and selective multiple choice. In the first 3 questions, we're gonna ask you about your religions, how often you practice your religions, and what type of contraceptive that you use. And in the last question, we're gonna ask like how your religion affect your points of view in sex and contraceptive. So after the approval, we share the survey through RootMe, text message, and QR code flyer that was sent MSC. And the data sample will collect about 81 students. Most of them are undergrad students, and the rest were grad students and their parents. During our surveys, all the questions and the answers were anonymous, voluntary, and respectful among the participants. The surveys were guaranteed to take less than 10 minutes, and the participant can leave anytime that they want. And about sexual question, we have a yes/no question and refer not to answer. So even you don't want to take the survey, we still respect your time and honesty.
Moving on to the results, based on what you have seen and what you know, what do you think the results have showed? A little over 70% of the people who took our survey identified as Christian. About 12% identified as atheist, while the remaining numbers identified as Hindu, Jewish, Muslim, Catholic, Buddhist, or agnostic. The next question we asked was how involved they are with their religious practices. 33% had said that they had practiced every day, 16% practice a couple of times a year, 13.6% do not practice, 8.6% practice weekly, 7.6% practice a couple times a week, 8.6% practice a couple times a month, and the remaining numbers were either inapplicable or practice about once a month. The next question we asked was, are they sexually active? To which 54.3% said yes, 38.3% said no, 6.2% preferred not to answer, and 1.2% said that they were unsure. The next question we asked was what type of birth control or contraceptive they would or have used. On this question, we allowed the respondent to choose more than one method of contraceptive or birth control. The most picked methods were the male condom, which was 61.7%. In second place was the birth control pill at 50.6%. Next was abstinence at 30.9%. And then we had withdrawal at 22.2% and the IUD at 16%. We also had a 9.9% choose the emergency contraceptive, and we also did have 8.6% chose to use none. The next question we asked was whether their religious views affects their views on sex. 32.1% said they strongly agreed, 27.2% said they agreed, 17.3% stayed neutral, 9.9% disagreed, 13.6% strongly disagreed. And finally, we asked whether their religious views affected their views on birth control. 19.8% strongly agree, 6.2% agree, 22.2% stayed neutral, 17.3% disagreed, and 34.6% strongly disagreed.
So, how can we utilize what we learned today in a career in healthcare? As future healthcare workers, we have to realize that we will help patients who come from all kinds of different backgrounds, including religion. For some, religion is a major part of their life, and they incorporate it into a lot of their opinions about health practices, including contraceptives. It is important to respect their opinions and their religion no matter what, as well as remember that some patients may not be educated on contraceptives, so giving them plenty of resources and information is really important. The most surprising conclusion we came to in completing this research was how many participants' opinions on contraceptives were not influenced by religion. Our results show that 34.6% of participants answered strongly disagree, and 17.3% answered disagree to the statement, "My religion affects my view on contraceptives." In many popular religions like Christianity, Islam, and Judaism, abstinence is heavily encouraged until marriage. In Catholicism, the use of birth control for the purpose of contraception can even be considered worse than murder. The overall opinions of contraceptives from religions are typically unfavorable, so seeing a small correlation between personal opinions and the religion's opinion was really shocking. One limitation we had when surveying the participants was having COVID-19 affect the methods of data collection. We could not go out on campus to do in-person interviews and instead had to rely on our friends and peers to complete our survey. Another limitation was not having a diverse sample. Our sample was over 70% Christian, and if we had more diversity in the religions of the sample, I think our results could have changed from what we had received. Sex research was not too difficult because of the methods we put into place. We gave participants complete anonymity and the ability to prefer not to answer to any question. This helps participants feel more comfortable to be completely honest because we know that sex can still be a very off-limits topic of conversation for many. Thank you so much for watching our presentation and have a nice day.